Question 1. A nurse is caring for 4 patients. Which patient should be assessed first to ensure safety? A. A patient with a blood glucose of 145 milligrams per deciliter. B. A patient with new onset confusion and restlessness. C. A patient requesting pain medication for 6/10 pain. D. A post-op patient with 50 milliliters of output in 4 hours. Answer. B. A patient with new onset confusion and restlessness. Question 2. What is the nurse's priority when a patient refuses to wear the identification band? A. Document the refusal and continue care. B. Inform the charge nurse and remove the patient from procedures. C. Educate the patient on the importance of the ID band. D. Tape the band to the bed rail for identification. Answer. C. Educate the patient on the importance of the ID band. Question 3. Which task is appropriate for the RN to delegate to a UAP? A. Ambulating a patient with a stable gait post-op day 2. B. Teaching the patient how to use a walker. C. Monitoring for shortness of breath during ambulation. D. Assessing a dressing for drainage. Answer. A. Ambulating a patient with a stable gait post-op day 2. Question 4. What is the best method to prevent medication errors in the hospital? A. Use barcode scanning before administration. B. Ask another nurse to verify each dose. C. Document after all meds are given. D. Administer medications without delay. Answer. A. Use barcode scanning before administration. Question 5. A nurse is precepting a new graduate. Which action by the new nurse requires immediate correction? A. Leaves bed in high position after wound care. B. Verifies MAR before giving meds. C. Uses gloves for perineal care. D. Reports abnormal vital signs to provider. Answer. A. Leaves bed in high position after wound care. Question 6. What is the nurse's first action after discovering a fire in a patient's room? A. Pull the fire alarm. B. Close the door to contain the fire. C. Rescue the patient from the room. D. Extinguish the fire using a fire extinguisher. Answer. C. Rescue the patient from the room. Question 7. A confused patient is at risk for falls. Which intervention is most effective? A. Restrain the patient with soft wrist eyes. B. Place the call bell within reach. C. Keep all 4 side rails up. D. Assign a sitter to remain with the patient. Answer. D. Assign a sitter to remain with the patient. Question 8. Which error is considered a never event by the Joint Commission? A. Development of mild rash from medication. B. Patient fall resulting in hip fracture. C. Urinary tract infection after catheter insertion. D. Surgical wound infection. Answer. B. Patient fall resulting in hip fracture. Question 9. The nurse is preparing to administer digoxin. What is the priority before administration? A. Check the potassium level. B. Ask about nausea. C. Take apical pulse for 1 minute. D. Check blood pressure. Answer. C. Take apical pulse for 1 minute. Question 10. What is the safest method for identifying a patient before medication administration? A. Ask the patient's room number. B. Check the name on the bed label. C. Ask the patient to state their name and date of birth. D. Verify the name on the prescription label only. Answer. C. Ask the patient to state their name and date of birth. Question 11. Which action by the nurse helps reduce the risk of central line-associated bloodstream infections, CLABSI? A. Clean the insertion site with iodine. B. Change the dressing every 72 hours. C. Perform hand hygiene before and after line care. D. Flush the catheter with saline daily. Answer: C. Perform hand hygiene before and after line care. Question 12. Which task should not be delegated to an LPN? A. Administering oral medications. B. Reinforcing teaching about medication side effects. C. Evaluating a patient's response to a new medication. D. Monitoring wound drainage. Answer: C. Evaluating a patient's response to a new medication. Question 13. What should the nurse do first after discovering a patient received the wrong medication? A. Call the provider. B. Notify the pharmacist. C. Assess the patient. D. Complete an incident report. Answer: C. Assess the patient. Question 14. Which action by the nurse manager best promotes a culture of safety? A. Punishing staff for all errors. B. Encouraging staff to report near misses without fear. C. Requiring double charting. D. Mandating additional daily staff meetings. Answer: B. Encouraging staff to report near misses without fear. Question 15. A patient is prescribed warfarin. Which finding requires the most immediate action? A. INR of 3.1. B. Hematuria noted in the Foley catheter. C. Mild bruising on the arms. D. Dark tarry stool reported once. Answer: B. Hematuria noted in the Foley catheter. Question 16. A patient is scheduled for surgery and states, "I don't understand what's going to happen." What is the nurse's priority action? A. Explain the procedure to the patient. B. Call the surgeon to clarify the procedure with the patient. C. Ask the family to explain it. D. Cancel the procedure. Answer: B. Call the surgeon to clarify the procedure with the patient. Question 17. A nurse is caring for a patient who is on seizure precautions. What item is essential at the bedside? A. Restraint kit. B. Suction equipment. C. Telemetry monitor. D. AMBA bag. Answer: B. Suction equipment. Question 18. What is the priority action when a nurse receives a verbal order in an emergency? A. Record it immediately in the chart. B. Have another nurse verify the order. C. Repeat the order back to the provider. D. Wait to document until later. Answer: C. Repeat the order back to the provider. Question 19. What is the most appropriate intervention for a patient at risk of pressure injuries? A. Turn the patient every 4 hours. B. Use donut-shaped cushions. C. Keep the head of the bed elevated at 90 degrees. D. Reposition the patient every 2 hours. Answer: D. Reposition the patient every 2 hours. Question 20. Which action demonstrates proper use of the timeout procedure in surgery? A. The circulating nurse confirms the room is clean. B. All team members pause to confirm identity, site, and procedure. C. The surgeon checks consent after surgery. D. The anesthesiologist calls out the patient's name. Answer: B. All team members pause to confirm identity, site, and procedure. Question 21. A nurse enters a room and finds a patient on the floor. What is the priority action? A. Notify the provider immediately. B. Assess the patient for injuries. C. Call the charge nurse. D. Complete an incident report. Answer: B. Assess the patient for injuries. Question 22. A diabetic patient is found confused and diaphoretic. What should the nurse do first? A. Call the physician. B. Give 4 ounces of orange juice. C. Document the findings. D. Prepare to administer glucagon IM. Answer: B. Give 4 ounces of orange juice. Question 23. Which task can the nurse safely assign to a UAP? A. Assessing pain in a post-op patient. B. Feeding a client with stable dysphagia. C. Documenting intake and output. D. Administering a rectal suppository. Answer: C. Documenting intake and output. Question 24. A nurse is preparing to administer a high-alert medication. What is the priority step? A. Call the pharmacy to verify the dosage. B. Have another RN independently verify the medication. C. Ask the patient if they've taken it before. D. Check the medication expiration date. Answer: B. Have another RN independently verify the medication. Question 25. Which instruction is most important to teach a patient using a walker? A. Slide the walker ahead and step forward with both feet. B. Keep the walker beside them when turning. C. Move the walker forward before stepping. D. Use a cane on the same side as the weak leg. Answer: C. Move the walker forward before stepping. Question 26. What is the best way to reduce alarm fatigue in a clinical setting? A. Disable alarms on low-priority monitors. B. Assign one nurse to monitor all alarms. C. Customize alarm parameters for each patient. D. Silence alarms after the first alert. Answer: C. Customize alarm parameters for each patient. Question 27. A nurse receives a handoff report. Which patient should be assessed first? A. A patient who needs discharge instructions. B. A patient awaiting transport to surgery. C. A patient who received for morphine 10 minutes ago. D. A patient scheduled for a routine dressing change. Answer: C. A patient who received for morphine 10 minutes ago. Question 28. Which finding requires the nurse to intervene to maintain patient safety? A. Call bell within patient's reach. B. Bed alarm is activated. C. Two side rails up. D. Oxygen tubing taped across the floor. Answer: D. Oxygen tubing taped across the floor. Question 29. A post-op patient reports numbness in the toes after a cast application. What is the priority? A. Encourage the patient to elevate the leg. B. Notify the healthcare provider immediately. C. Reposition the leg. D. Document the finding and reassess later. Answer: B. Notify the healthcare provider immediately. Question 30. A nurse walks into a room and sees smoke coming from a wall outlet. What is the priority? A. Pull the fire alarm. B. Unplug the equipment. C. Evacuate the patient. D. Close the door. Answer: C. Evacuate the patient. Question 31. Which statement by a student nurse requires intervention by the preceptor? A. I will identify the patient using two identifiers. B. I can recap a needle if I am careful. C. I'll dispose of the needle in the sharps container. D. I'll scan the medication before giving it. Answer: B. I can recap a needle if I am careful. Question 32. Which is the best strategy for reducing risk of patient misidentification during care? A. Color code ID bands. B. Have family confirm patient name. C. Use barcode wristbands and scanners. D. Label patient rooms. Answer: C. Use barcode wristbands and scanners. Question 33. A nurse needs to lift a heavy box. What action ensures safety? A. Bend at the waist and lift quickly. B. Stand with feet together and bend knees. C. Bend at the knees and keep the back straight. D. Use back muscles to support the lift. Answer: C. Bend at the knees and keep the back straight. Question 34. Which action demonstrates appropriate time management for patient safety? A. Delegating vital signs for unstable patients. B. Completing all charting before beginning assessments. C. Prioritizing care based on acuity. D. Seeing patients in room number order. Answer: C. Prioritizing care based on acuity. Question 35. During an emergency evacuation, what patient should be evacuated last? A. Ambulatory patients. B. Critically ill patients on ventilators. C. Patients needing minimal assistance. D. Postoperative patients. Answer: B. Critically ill patients on ventilators. Question 36. A patient with contact precautions needs transport. What is the correct action? A. Apply a mask and gloves to the transporter. B. Remove PPE before moving the patient. C. Place clean gown and gloves on the patient. D. Transport without notifying the receiving department. Answer: C. Place clean gown and gloves on the patient. Question 37. A nurse makes a medication error. What is the first action? A. Complete an incident report. B. Notify the healthcare provider. C. Inform the charge nurse. D. Assess the patient's condition. Answer: D. Assess the patient's condition. Question 38. Which practice enhances communication during handoff? A. Using subjective language. B. Including unrelated social details. C. Using SBR format. D. Discussing information in public spaces. Answer: C. Using SBR format. Question 39. Which activity poses the greatest fall risk in an elderly inpatient? A. Using the call bell to request help. B. Wearing non-skid socks. C. Getting up quickly to use the bathroom. D. Asking for assistance to transfer. Answer: C. Getting up quickly to use the bathroom. Question 40. What is the safest method to dispose of a used insulin pen needle? A. Cap the needle and throw it in regular trash. B. Recap the needle and place it in red bag. C. Place uncapped needle in a sharps container. D. Disinfect the needle and reuse it. Answer: C. Place uncapped needle in a sharps container. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.